Many patients tell me, Doctor, I anyway wear socks. So what's so special about diabetic socks? And honestly, that's a fair question. Because the difference isn't about fashion, it's about protection. Especially when you have diabetic neuropathy. So what is diabetic neuropathy? And why? Your regular socks may be a problem. So in diabetic neuropathy, the nerves of the feet get damaged. Now this leads to your burning, numbness, tingling, reduced sensation. Now the problem here is if you're wearing your regular tight socks with the hard elastic bands and the tight seams, it can create pressure. It can reduce the circulation and it can even cause small injuries. The worst part here is that many patients can't even feel all of this happening to them. A good diabetic sock usually have a non-binding top so the blood flow is not restricted, minimal or seamless stitching reducing friction, moisture wicking fabric which keeps your feet dry and lowers the infection risk, soft cushioning to reduce the pressure while walking. For example, socks like the Thermaessence diabetic socks are designed keeping these exact clinical concerns in mind. Circulation, moisture control, and protection for your sensitive feet. In fact, in my own practice, we have been recommending these socks for the past 5 to 6 months in selected patients with diabetic neuropathy and high risk feet. The feedback has been reassuring: less discomfort, better day-long comfort, and improved confidence while walking. In fact, some patients have even come back and bought multiple pairs, which as a doctor matters to me more than any claim on the box. Now, who should consider diabetic socks? Diabetic socks are especially useful to you if you have numbness or tingling, if you had foot ulcers in the past, your feet swell by evening, you're on your feet for long hours, or your skin is dry, sensitive, or prone to cracks. Think of diabetic socks as a protective layer for your feet. They definitely don't replace your foot care, your foot wears, and regular checkups, but they support all of it. When it comes to diabetes, it's often these small consistent changes that prevent bigger problems later.